Look okay? Am I in the middle?
Bring a drink.
Right there.
Eat here for an hour.
Okay.
Drink. You guys have a drink?
Good.
You get egg.
Should be like something with sodium in it. You should have, if it's hot out, you should have salt with it.
Well, that's a very good. I know that Trish and Sandy wanted to say that in a nice way, but they can't always do that. But in the nicest possible, friendly and supportive way, we would like to say that we often see people who are a little tired after the surgery. And let's see if we can explain that. The surgery takes a person who has a body that's abnormal and begins to fix it. The abnormality before surgery, at least in part, is that a heavy person, a heavy woman, a heavy man's body inappropriately retains excess salt and water. And you see that with swollen ankles, shortness of breath, high blood pressure, and even headaches can come from that excess salt and water being retained in the body. Now the body has a very precise tool to control the amount of salt and water the body retains, and that system, that thermostat, that tool inside of you is abnormal when you're heavy. In a wonderful effect, within hours of your new MGB surgery, that thermostat gets affected. That thermostat gets turned down, and you begin to have a massive loss of salt and water out of the body. In fact, though, it's so powerful that in many cases it overwhelms the body in the first weeks and months after surgery, and you become dehydrated. It's as if someone had cut off your hand and you bled out. And you bleed out, in this case, no red blood cells, but salt water. Now, in part, that's a good thing. That's the surgery actually doing its business, but it's so powerful it can overwhelm you and leave you tired and weak and washed out. And nothing wrong with that. We haven't had people get in trouble with that. But sometimes, if you can't keep up by drinking enough of salt and water, then you have to actually come into the hospital and get IV fluids. Okay? So, as a warning to you and everyone having surgery this week, you need to do a little bit of effort to catch up. Now, also, we put a roadblock in the way of you catching up. Okay? So, for example, if you were out and working in the yard, here in Las Vegas, for example, and you went out and mowed the lawn, painted the house, were on the roof putting solar panels up, and helping the earth, an hour or two in the 100, 110 degree weather, and you came in, you could be dehydrated even without the surgery. But you could catch up. You could take a big quart bottle of Gatorade and just drink the whole thing all at once. Just drink that fast. You can't do that after the surgery. We have said, kind of, your gas tank is empty, here's an eyedropper, go fill it up. Okay? So that's unfortunate, but what it means is drink, 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 drink as little drops because you can't catch up. And there's something else interesting. We call it dehydration. Dehydration sounds like water. Yet, water by itself won't fix it. And so I think I told this story last week, but I'll tell it again for the video. I used to be a trauma surgeon, a professor of surgery at the University of North Carolina, and I would teach my residents how to take care of trauma patients. And I think I told you the story about the trauma victim. Imagine you're with me in the ER, and we get a call that somebody's just been shot. Their blood pressure is 60/40, and they're coming in, and you're my new resident, and we turn to the nurse and say, get me 2 bags of fluid. I want to give IV fluid as soon as the patient comes in. Okay, and the nurse says, I have D5W, sugar water, or I have saline, salt water. And I turn to my resident, you're my new resident. What do we give this bleeding patient to resuscitate them? Saline, right. Why? Because D5W, and the patient will not get an increase in blood pressure, will not be resuscitated, and will pass away in many cases. Because the sugar gets metabolized and then the water leaks out of the bloodstream and the blood pressure doesn't come up. So for you, do you want to hold up what you're drinking?
Oh, it's useful.
What's in there? Any salt?
No.
Right. So you are like the person who gives my gunshot wound victim the D5W, the sugar water. You're going to have trouble resuscitating yourself with the clear water. Now you can fix it because you're not a gunshot wound victim. You could have that plus a cracker. That would give you the salt. Or you said you chose the pretzel. But you need that sodium because sodium is the ion that's in our bloodstream. So it holds the blood in and gives you more energy and takes away that feeling of tiredness and weakness. So constant sipping during the coming week. Constant sipping. Stacy,
Yes.
are you going to sip? Could you sip now?
Could I sit now?
Would you sip a little? Just a sip. Just to show the new people how that works. That was sipping. Oh, very good. So we want to do that because otherwise you can lose so much fluid and be so dehydrated you might have to get admitted to the hospital and get IV fluid. And again, the trick is, you know, Dr. Rutledge says drink, and then I give you a surgery that blocks you from drinking. Drink, I can't drink. Drink, I can't drink. Drink, I can't drink. What's wrong with you as a patient? Won't you listen to me? So you have to drink constantly because you can't drink a lot. Does that make sense? Okay, I think we turned that off. So that's the